Hi, Dr. Applin here, and today we're going to be talking about real options for relieving back pain. And this is a huge issue, especially here in the United States, where it's estimated that 80% of all people will have at least one severe incident of lower back pain in the course of their lifetime. And what we found in our office is that's especially true for people who are sitting at a desk for long periods. And if you think about it, it makes total sense because the lower back carries the weight of everything above it. And actually, as you sit for long periods, it's compressing the lower back more and more and increasing the amount of pressure that is there, which increases the amount of pressure on the nerves. It can cause nerve pinching, muscle irritation, muscle tightness. And what we hear quite frequently is, a patient will come in and say, oh, I just made this movement the other day and all of a sudden my back started bothering me. But when we question them further, quite frequently the tightness in the lower back has been there for years and years. And if we shoot a series of x-rays, oftentimes we'll see the beginning stages of osteoarthritis in the lower back, which is quite frequently asymptomatic, meaning there's no pain until it reaches a more progressed stage with the arthritis. So, what are some real options for relieving back pain? If you follow the traditional medical approach, they usually do a series of three things. You're going to take pain relievers, anti-inflammatories, and muscle relaxers, which symptomatically can actually help a lot, but it's not doing anything for the cause of the pain, which is tight muscles, restricted joint mobility, oftentimes weakness or core weakness. You hear everyone today saying you need to strengthen your core. You need to strengthen your core. Well, this is why. Having a strong core can actually alleviate or prevent lower back pain. So the traditional approach, like I said, while it may offer some symptomatic relief, it's not going to do anything for the actual cause of the problem. And what we frequently see is people who are on medication for things like lower back pain for long periods of time, is the pain in the back, or the problem that's causing the pain in the back, is actually worsening, but you don't know that it's worsening because the medication is covering up the symptoms. So over the course of months and years, taking the medication, the cause of the pain is worsening, and then if you try and scale back or reduce or eliminate the amount of medication you're taking, then you realize the full extent of what's actually going on with your back, and it can be quite painful and even become a surgical type case. Surgery is another option for helping to treat lower back pain. I always tell people that sometimes surgery is necessary for lower back pain, but it should always be a very, very last resort. And the reason being is you can't undo surgery, and you have about a 50-50 chance of it actually helping your condition or not. So if you've already exhausted physical therapy, chiropractic care, acupuncture, massage, and you're just seeing no relief from your pain, or your pain is progressively worsening, then it might be in your best interest to seek a surgical consult, but really never before then. With physical therapy, the whole goal with treatment is to improve the stability in the lower back. The pain in the lower back is just a manifestation of altered function. So by altered function, we mean muscle tightness, muscle weakness, reduced joint mobility, and reduced flexibility. And oftentimes, if we can massage out those sore muscles, stretch the tightened muscles, improve the joint mobility in the lower back, and then stabilize the core musculature, the pain just kind of takes care of itself. So go ahead and read through today's blog post on real options for relieving back pain, and I hope it's very informational. Thanks.